We're going to call up a couple others.
Wishing to speak opposing the bills as written, we have Renee Pinsky and Tammy Cruiser representing the Michigan Radiological Society. Both doctors.
Okay. Doctors, we thank you very much. We have another question. I'm sorry.
Thank you. Thank you, Mr. Chair, and thank you for your testimony, obviously, and for your commitment to Michigan's women and the work that you do. I have two questions as well, and the first one is, so you described what's in the radiology report, and what I think is the concern to a lot of folks is that that's a report that you send as the radiologist to the physician, and the physician decides what they tell the patient, the woman. And I think that there's a lot of us who are focused on giving patients the most control that we can give them over their health and their healthcare costs and their healthcare treatment options. And so if this is the same information you're already giving to their primary care physician, and in these words, you said this is exactly the kind of information that you do provide to them, where is the harm in making sure that women get that information directly?
I think the concern is that we're not giving them a direct answer as to what to do with the dense breasts. It's a mammographic finding. It's not even 100% confirmed that it actually does result in an increased risk. That is controversial. So we're already dealing with an issue that is not 100% based in science, okay? The general consensus is that there's a slight increased risk. And the issue, I think, is mostly geared towards the supplemental screening, and that we're suggesting with these words that there are tests that are going to save a woman's life by diagnosing her breast cancer earlier, and that has not been proven. It has only been proven for mammography. It has not been proven for either MRI or for ultrasound. Yes, we can find more cancers, but they have not been shown to affect a woman's ultimate outcome. And so this is a very emotional issue, and it's hard to just sort out in a couple of sentences. But we want to make sure that what is presented to the women is fair and representative, and what is really truly going to help them. There's a lot of issues now in breast imaging in terms of how much are we helping with mammography, diagnosing things early. If we diagnose things early, does it really change their ultimate outcome, as opposed to knowing that you have cancer earlier rather than later? And it is controversial. These are controversial issues. It's not as cut and dried as this. So bringing up the issues of supplemental screening as though that's the answer to your problem with dense breasts. If you lose weight, stop drinking alcohol, nurse your children for a year, do these other lifestyle things that change your risk of breast cancer, those are going to be far more important than this very small thing that you really can't change. It's just, it's just the way you are.